And now we turn our attention to the new health care bill that was passed into law recently. And joining us at the table is Alec Macgillis of the Washington Post, here to talk about also a new book.
Yes.
The Washington Post put out a book, The Inside Story of America's New Health Care Law and What It Means for Us All. You can see my notes attached there to the book. There's a couple stories this morning in the paper about the latest on this health care bill. This is one from the Washington Post. 18 states declined to run high-risk insurance pools. What's going on?
This is one of the first provisions in the bill that we're setting up high-risk pools across the country. It's sort of a temporary thing, kind of a bridge to get us to the main provisions of the bill, which go into effect in 2014. Basically, people who have pre-existing conditions who are in big trouble right now because they can't get plans, they are going to be able to go into these high-risk pools that are being set up. This is only going to be a sort of temporary stopgap until 2014. Starting in 2014, insurers will have to take these people. This high-risk pool is going to be probably going to be a problem. It's going to be very tricky to set up. There may not be enough money for it, and some states are already actually resisting setting them up in their states.
Yeah, 18 states are declining right now. It says that a lot of states are concerned that if funds run out, there could be difficult choices, political choices, reducing benefits, raising premiums, or limiting enrollment.
Right. This is really kind of this problem has arisen basically because they've waited until 2014 to implement the main parts of this law. So they had to figure out some way to take care of people who are in the worst off positions basically until then. And this is not an ideal solution. Basically what you're doing is you're taking all the sickest people and putting them into a pool, which is sort of not the way insurance is supposed to work. And on top of that, you've got states, some of these states that are opposed to this bill, who are simply saying we're not going to cooperate. So this could get kind of messy.
Alec Macgillis is one of the co-authors of this book, The Inside Story of America's New Health Care Law, here to talk about the law, what it means, what's being implemented now, what does it mean for doctors, hospitals, Medicare. Start dialing in now. The phone numbers will be on your screen. Lots of questions about the impact of this.
Right.
Let's start with doctors. What does it mean for doctors first?
Doctors are, it's interesting, doctors are going to see an impact, but they're not going to see as much impact as maybe a lot of people thought they should have. This law really did not do as much as it could have to take on sort of the cost problems on the provider side, sort of the cost problem that we're facing among hospitals, doctors, drug makers. The law is much more focused on the insurers, and so doctors are going to see some sort of more peripheral impacts. There's going to be more money for doctors who want to go into primary care, more money to help them with their medical loans and whatnot. They're going to be encouraged over time to change the way they work somewhat, to sort of get into networks, basically, where they're working together instead of working in small practices, working maybe more on salary rather than taking fee-for-service, which is the way most of our healthcare is delivered now. But in a lot of ways, doctors, partly because they had such a powerful lobby in Washington, really avoided a more direct impact than they could have had.
The story today in the Washington Post featuring the book says that there's going to be an emphasis on primary care.
Yes, I mean there's a big concern that when you expand coverage, as we're doing in this bill, that you're going to have a problem of a lack of access to primary care. More people coming into the system, and just not enough doctors to go around. And so and the bill does provide a quite substantial amount of money to encourage doctors to go into primary care to serve in underserved areas. But again, that's not really the main thrust of the bill.
For doctors, a big concern was reimbursements, Medicare reimbursements. Here's a tweet from one of our viewers. HHS published Medicare broke in 2016. Boomers at 65 add 40% to the number of seniors, and the health bill cuts $50 billion. What will be cut?
The cuts in Medicare, I mean, there was a lot of concern about this, obviously, during the whole debate. The cuts in Medicare are really, and they were agreed to by the hospitals and the doctors, and they come to about $150 billion over the first 10 years. They're, in a sense, calling them cuts is somewhat of a misnomer because they're basically every year doctors and hospitals get more from Medicare to account for inflation and the rising costs. They are now agreeing to basically a smaller increase in their Medicare reimbursements than they would have otherwise gotten. And they agreed to this because they realized that if they didn't agree to this, they might have taken a bigger hit. This was basically their deal to avoid something like the public option. Doctors and hospitals were very opposed to the public option. People sort of assumed that it was the insurers who were most opposed to the public option, this government-run insurance plan that people could have bought into. In fact, it was the doctors and hospitals who were just as opposed to it, because that would have meant much lower reimbursements for them in all likelihood.
We're talking about the impact of this health care law. A lot of questions out there, a lot of debate about what it will do. Alec Macgillis is the co-author of a new book on the law. Boston, Mark on the Republican line, you're our first phone call. Go ahead. Mark, you're on the air.
Hello, this is Sheila.
Oh, sorry about that. My fault. Go ahead, Sheila.
Listen, the high-risk pool here in Georgia, Oxendine, our insurance commissioner, has said that he had sent a letter to Kathleen Sebelius saying that that Georgia was not going to participate. I'm one of those people that needs insurance because of pre-existing conditions. Is the federal government going to take that over?
Yes, Sheila, they are, in fact. You're right. He was the first commissioner to come out and say that he was not going to go along with setting up this high-risk pool in his state. It was sort of another aspect of some of this kind of states' rights opposition that we're seeing in a lot of states, which has mostly manifested itself in people saying they're going to sue about this mandate that's in the law, that mandate that everyone carry insurance. But when the insurance commissioner came out in Georgia and said that he was not going to help out with setting up this high-risk pool, Kathleen Sebelius said that the federal government would be able to sort of do that for the state, that there's a provision in the law that the high-risk pools will be, states will not be left without them just because the state is refusing to cooperate. There's more of a problem. There's going to be much more of a problem with states that are not being cooperative when it comes to the really big part of the law in 2014, when we start setting up these new marketplaces called exchanges that the states are going to set up, where people are going to buy insurance. If states are really being kind of grudging and opposed to this law, that's going to be a tremendous problem if they're simply not helping to set up good exchanges in their state.
Boston, Mark on the Republican line. Go ahead.
Well, clearly, if the federal government forces the states to violate their religious beliefs by violating the Establishment Clause and Free Expression Clauses of the United States Constitution, by forcing states to fund abortion, then the federal government is breaking the 10th Amendment to the United States Constitution.
What about the abortion provisions?
Well, the abortion provisions, they ended up in a very kind of complicated language, and there's really actually great uncertainty about how this is all going to play out. A lot of people who've looked closely at the language think that it's quite possible that there's actually going to be very, very little abortion coverage provided in these plans that are going to be offered on these new exchanges. Basically, the language they ended up with is that companies can offer plans that include abortion coverage on these exchanges, on these marketplaces where we're going to buy insurance. But people who buy into those plans are going to have to write separate checks, make separate payments every month for their premiums. One to go to the bulk of their coverage, and then a very, very small payment, like $1 a month or something, to go toward the abortion coverage. And a lot of people think that this is just going to be so unwieldy, both for the insurers to implement, and that a lot of people are just going to think this is crazy. Why do I have to write 2 checks for my insurance plan? Even people who, young guys, older women, everyone who buys into these plans is going to have to write 2 checks, a separate check for abortion coverage. That there might just not be a market for these plans because people are just going to think this is just deeply kind of weird and unappealing. So it's actually quite possible that you're going to see very little abortion coverage in these plans. It's worth noting that most private insurance plans today do include abortion coverage. A lot of people don't realize it, but chances are if you're getting coverage through your employer, that coverage very well may include abortion coverage.
Another tweet here from Gun-Toting Dem says, where's the list of these rogue 18 states? I want to start calling their governors. Do these states have, are they legally able to opt out of these high-risk pools?
They can opt out of them. That's why we're seeing that now. But again, I think it's perhaps being somewhat overstated as a problem because the federal government is able to to set up these pools sort of on their behalf. The bigger concern with these high-risk pools really is simply whether they're going to work. They've set aside $5 billion for them over the next 4 years until the main parts of the bill go into effect. A lot of people think that's just not enough money. Right now, some states already do have high-risk pools on their own, and we're spending about $2 billion a year to cover about 250,000 people in these existing high-risk pools. $5 billion over 4 years probably ain't going to cut it. So it's really